Dear viewers, we are back from this report and we have been joined by our second and final guest for this evening, Dr. Noble Zakaria, the specialist in internal medicine. Good evening, doctor. Welcome to Hala Kuwait.
Thank you.
It's our pleasure to have you with us this evening. So in the beginning, can you tell us what internal medicine, doctor, is?
Internal medicine is a specialty which deals with the organs within ourselves.
Yes.
All the internal organs like the heart, the lungs, the liver, the abdomen organs like kidney, brain, glands, joints and all that.
That's amazing. So everything really.
Yeah, everything that's inside the body which controls the
Yes.
body. In fact, many of the common diseases like diabetes is very common in Kuwait. It is something that affects many of these internal organs. So the internal medicine specialist actually is trained and experienced
Right.
in preventing, detecting and treating these complications.
Of course. So what are general diseases? Let's get into that part.
The general diseases that we face in Kuwait, one of course is very common is diabetes and its complications. Then there is hypertension, there is allergy, asthma, abdominal problems, abdominal pain, fullness, altered bowel habits, then the dizziness, giddiness, neurological problems, joint problems, the glands
Right.
problems. And these are all very
Yes.
common in Kuwait. And of course, something that is very important is what is called the metabolic syndrome,
Right.
which is very common in Kuwait, which is where the body has got abdominal obesity. The person
Yes.
is obese, like the apple shape is called. And along with that comes blood pressure above 130 by, there are actually 5 factors for it, 130
Right.
by 80, blood sugar above 5.6, fasting blood sugar above 5.6, high triglycerides, low HDL. There are 5 components to it. If you have 3 or more, it is metabolic syndrome.
Right.
It is coming to very good prominence in Kuwait because it is the forerunner of many diseases like diabetes, hypertension, heart disease, PCODs in women, some cancers, fatty
Right.
liver disease. So many diseases. This is the pre-run of that.
So doctors always check for that if the patient has any of these illnesses or diseases that you have
Yes,
mentioned.
Yes.
Definitely. So we can tell that it's pretty unsafe.
Yeah, it is something that has to be tackled.
For sure. So what are the causes of diabetes? You mentioned diabetes a
Yes.
few times this evening, and I think it's a very, very common disease.
Absolutely, absolutely. Now, actually, for us to get energy, the glucose, the blood glucose has to enter into our cells.
Yes.
And this is modulated by a hormone called insulin, which is made in the pancreas, which is an organ situated in the abdomen.
Right.
Now, the insulin acts on receptors on the cells called insulin receptors, which leads to opening a gate and entry of glucose into the cells. Now,
Yes.
in diabetes, there are 2 types of diabetes mainly. In type 1, there is destruction of these insulin producing cells. So, there is hardly any insulin in the blood. So, these receptors are not stimulated and glucose cannot enter the blood. So, it accumulates in the blood
Oh, wow.
producing diabetes. The more common is type 2, which occurs mainly in adults. Type 1 occurs mainly in children and
Yes.
adolescents. Type 2, there is insulin production in the pancreas, but the insulin receptors are defective. So, they are not able to stimulate the insulin receptor and therefore, the gates don't open, the
Yes.
glucose cannot enter. And this is something that is preventable because there's a lot of genetic component to this, which of course
Of
you cannot
course.
help. If one parent has diabetes, then the chance of the offspring, the child having diabetes is about 40%.
Oh, wow.
And if both parents have diabetes, then it becomes 75%,
Very high percentage.
very high percentage. And this is like if you have the genes, it is like putting a bullet in the gun. It doesn't fire by itself. You have to pull the trigger.
Right.
So there are what are called triggering factors, which can be taken care of.
So what are
So
these?
triggering factors, main thing is obesity,
Yes.
then the wrong kind of food, the food that is rich in glycemic index calories, which elevates the blood sugar, like the fast food, the grains,
Okay.
the tubers, potato tubers, sweets, all these raise the sugar. Then there is the sedentary lifestyle, no exercise.
Yes.
Then of course in Kuwait one comes across people who are very anxious, stressful and depressed. This again adds on to it.
Right.
Smoking adds on to it.
Yes.
Then there are certain medicines like steroids which they take will precipitate diabetes.
Of course.
So a number of components lead to type 2 diabetes.
Definitely, and I think that's very unfortunate, and we should try to avoid all of these things.
Correct.
As you said, if one of our parents or both of them actually do suffer from diabetes, and we do have the genetic chance to get it. So I think that covers how we can avoid diabetes. But is there any other tips you would like to give us on avoiding diabetes?
Basic thing is you try to reverse the triggering factors.
That's it,
Triggering
basically.
factor, because you
Definitely.
cannot take away the genes as of now. Maybe in future there'll be some gene therapy also. We don't.
Of course, hopefully. I think everyone would feel safer if that does come true. So I think there's a lot of diseases that are considered very simple but are very fatal at the same time. For example, blood pressure.
Yes.
So what are the causes of blood pressure?
Blood pressure actually is a very silent disease. In fact, it's called one of the silent killers, because unless the blood pressure is very high, nobody becomes aware of it. And the causes again are genetic to some extent, and certain races have more incidence of hypertension.
Yes.
Then of course salt-rich food, food that is poor in fruits,
Yes.
because salt-rich food contains a lot of sodium, and fruits are present in potassium. So sodium and potassium would would balance kind of thing. So food that is low in potassium and rich in sodium can elevate blood pressure. Obesity, of course. Then the inactivity. Then there are
Yes.
certain drugs that we commonly take, like the painkillers, anti-inflammatory drugs,
Right.
steroids. All these precipitate high blood pressure.
Of
Then there are
course.
certain diseases like the endocrine system, like the pheochromocytoma, Cushing syndrome, and these are all leading to high blood pressure.
Definitely.
And one of the very important area, which is like the you can say where is the egg or the hen, the blood pressure and the kidney. The blood pressure
Yes.
can lead to kidney problems can lead to blood pressure.
Oh, wow.
So both. It's a vicious
So
circle.
you mentioned a lot of things that we do on a daily basis, which is a lot of salty food. A lot of us don't have enough fruit. So I think it's very unfortunate that we do have these habits in our lifestyle, especially with eating out and fast food and all of that. So basically, how can a patient avoid high blood pressure? Is it genetics only? What can they do about this?
Genetics, of course, we cannot do anything about it.
Yes.
But there's something called a DASH diet, that is dietary advice for stop hypertension, which is actually similar to the Mediterranean diet. A lot of
Yes.
fruits and vegetables, fish, hardly any red meat,
Right.
white meat, and good healthy oils like olive oil and all that. Avoid things like a lot of fat containing meat and salt containing food,
Right.
and all those will help avoid hypertension.
Definitely. So finally, doctor, what is your final advice to our viewers this evening?
Basically, both we pick up many of these silent diseases only through periodical examinations, checkups. So whenever a person is prone for these diseases, they should have periodical checkup, so that they detected early and treated. Then of course the healthy lifestyle is the most important, which involves eating the right kind of food, exercising. Exercising doesn't have to be very vigorous or anything like that. It is
Yes.
moderate exercise is enough for about 30
Definitely.
to 30 minutes to 1 hour. Then of course stress management is very important. Then of course avoiding things that can precipitate, like smoking or using unnecessarily painkillers.
Of course.
And, all these are very
Definitely.
important. And with this kind of a preventive approach, we can have a happy and healthy life.
Hopefully. Well, doctor, that was really great advice. Thank you so much for being with us this evening.
Thank you. It was a pleasure being here.
Thank you. Dear viewers, we had with us Dr. Noble Zakaria, the specialist in internal medicine. And with that interview, we have come to the end of our episode for this evening. I hope you enjoyed all of our interview segments as well as our reports. Of course, we'll be back tomorrow with another live episode, so please enjoy the rest of your evening and have a great night. you.